Hello, scholars. Today we will be talking about anti-glaucoma drugs for children. Do you know that it's important to consider the health of a child before prescribing anti-glaucoma eye drops? For asthmatic children, it's essential to choose an anti-glaucoma eye drop that minimizes the risk of exacerbating asthma symptoms. Here are some drugs to consider. Number 1. Beta blockers. An example of beta blocker to prescribe is betaxolol. Betaxolol is more selective and may be safer for asthmatic children. However, its efficacy in reducing eye pressure is lower compared to timolol. Bear in mind that while beta blockers like timolol is effective in reducing eye pressure, it can also worsen asthma symptoms in patients. However, a study found that timolol was well tolerated in children with asthma when used in low concentrations, particularly 0.1 to 0.25%. So, the next type of eye drop to prescribe is prostaglandin analogs. These eye drops are the most preferred options. They include drugs like latanoprost, bimatoprost, or travoprost. They are generally safe for asthmatic children. They work by increasing the outflow of fluid from the eye. Then lastly, number 3, carbonic anhydrase inhibitors. Eye drops like dorzolamide or brinzolamide can be used to reduce eye pressure. They are generally well tolerated and safe for asthmatic children. But here are some factors to consider when attending to children with asthma. Immediately after taking your case history and carrying out some preliminary examinations, refer the child to a pediatrician to monitor the asthma symptoms and lung function before they start or while they are using the anti-glaucoma eye drops. Then, consider using a spacer device or applying punctal occlusion when administering eye drops to minimize systemic absorption. Punctal occlusion is a technique where the puncta, small openings in the corner of the eye, are blocked or closed to prevent the eye drops from draining into the nasal cavity and being absorbed into the bloodstream. Remember that every child is different, and the best treatment option will depend on individual circumstances. So always consider to collaborate with other colleagues to determine the most suitable treatment plan for the child you're attending to. Once again, thank you for watching. This is the Optometry Scholars Academy, where we talk about eye care beyond limits. See you in our next video.